So we heard a bit about that in the video, but I've been trying to break this down and really conceptualize how the pandemic and COVID-19 is really affecting the neurological systems. And in doing that, I've tried to make it a bit simple and really break it down into three different sort of subsets of patients that have COVID-19 and who develop neurological consequences. And the first of those relates to the hypercoagulable state, so this tendency that some of these patients have to form blood clots. And that leads to some somewhat predictable consequences in some patients. So blood clots obviously can form in the legs, which, that's your deep venous thrombus, which can cause pulmonary embolus, which causes pulmonary involvement. It can also cause myocardial infarction or heart attack, which can cause circulatory arrest, which can cause problems with the nervous system. It can also cause stroke in a more direct fashion. So those are kind of the blood clotting aspect and the endothelial, the blood vessel involvement of the disease. So that's sort of bucket number one. And then you have bucket number two, which really relates to inflammation. And so everyone's, I'm sure, tired of hearing the phrase cytokine storm, but there's that aspect of this disease as well. So there are some papers out that have shown that in consequence to coronavirus and COVID-19, there's actually inflammatory process going on in the brain directly. So that would be encephalitis that's associated with the direct infection. And then there's an increasing body of literature that's starting to come out that people are developing later manifestations with either an autoimmune mechanism of inflammation in the brain or in the nervous system. So that's causing an encephalitis that's delayed in onset, or sometimes other things like Guillain-Barré syndrome, which is kind of a motor weakness syndrome. And so that's all sort of playing out. So that's bucket number two, is sort of this inflammatory picture. And then there's one that I think also is very interesting to talk about with this panel, which is the idea that some people have a really prolonged ICU hospitalization that goes on for weeks, perhaps even months, and they develop problems that are related to a prolonged hospitalization and ICU course. So some of those are direct neurological things like critical illness neuropathy or myopathy, but there's also a lot of concern about a post-ICU syndrome that has a PTSD kind of like flavor, and I think that is going to be ramified by some of the procedures we've had to put in place with coronavirus with all the isolations.